Now, transforming therapy is both very deep and very broad, as I've mentioned. It goes deep into the roots of the issues that people are bringing to the therapist. Behavior is just the expression of energy, and as we see with smoking, there may be many factors that are emotional drivers for that individual. Their stress, so-called, which is a very general term, may include particular emotions that they struggle with, and then tobacco is their attempt to deal with those emotional problems. Their attempt to feel happier, to be more relaxed socially, or other drivers that may be there subconsciously. Self-sabotage, sabotaging one's health, punishing oneself or others, and many other factors can be in the subconscious which lead to the behavior. Now, when you just learn a one-size-fits-all approach, as many training courses teach in that way, they learn maybe a generalized script, which is often very bland and not very motivating to the subconscious level of the mind anyway. But it's not personalized to the needs of the client, to what's going to motivate them most effectively to move away from tobacco, and what will motivate them to do the very best for their health. So therapists need to know how to elicit those underlying emotional energies so that they can develop the very best programming scripts for that individual. And that can be done even on that one session most often. When you have learned good interview and uncovering methods in your training, and we touch on those in those transforming therapy classes, so you learn about those to a certain extent if you haven't learned them very well in your earlier training. So our approach is not just to give suggestions only to the client that are very, very generalized, non-specific often, and non-specific to that client at least, and have often very limited or short-term value for the client.
Okay, I understand that. The great difference now between the, let's say, more traditional approaches and the transforming therapy approach is that you go to the deeper rooting levels of the issue, and you uncover first what the beliefs are, the self-image is, what's beneath the origin or the reason for smoking, and then you work from that. And I understand that you have, with your almost 40 years of experience and your background in various disciplines like medicine and psychotherapy, in addition to transforming therapy, hypnosis, you have such a vast body of knowledge and experience that you pack into this 1 or maybe even 2-day course on smoking cessation, with which you then teach people to leave the classic way of smoking cessation hypnosis and go more to a transforming attitude or perceptional way, and help the person then, the client, to achieve its goal even faster than it would be possible with any other method that is usually used in hypnosis. Is that correct?
Yes, that's a good summary. I've taken just the example there of Transforming Quit, our approach to smoking cessation, and just briefly talked about how important it is to deal with the underlying emotional energies and to be able to connect with those sufficiently, elicit those, understand them enough to be able to develop the very best programming suggestions. And you've mentioned that we are moving away, in the way you described it, from the classical approach. Well, I would say that's, to put somewhat different wording on it, I would say we're moving away from what has become the traditional approach, which is simply to give some suggestions. When we look at classical hypnotherapy, it is actually a very broad and deep approach to the subject matter itself. When you look back at the very ancient approaches to hypnotherapy. If we were to look into the past, the ancient Greeks, for example, we see that they had quite a sophisticated knowledge of different levels of consciousness, of going into the mind at a deep level, of the subconscious, the inner mind, working with the trance states, working with dream induction, dream analysis, working with going into the inner mind to discover the roots of the problems and find solutions, that the inner voice, the spirit within, as they would have described it, is understanding the problem and providing change.
I wonder if you would teach the classic Greek approach in a high intensive smoking cessation class.
Well, I would certainly be very interested and happy to bring as much of that was relevant to a 1 or 2 day training course. It is a fascinating topic in itself when one looks back to the past and sees all of the things that we're doing now really being done a long time ago with different philosophical wrapping around it, perhaps embedded in philosophies that were often religious or spiritual, but not always so. And we see all of the things we talk about with rituals, symbols. We see incantations, mantra, affirmations, things we would now call suggestions, being used at a high level of effectiveness. And so really, when we look to Mesmer, Dr. Mesmer and his approach, bringing this into the modern era, and of course I think it was in the background in specialized knowledge with groups who were involved with white and black magic and various mystical approaches. When we look at Mesmer's work dealing with the subconscious, the inner mind, and his theories, of course, of animal magnetism, mesmerism, which were then taken up and changed. These ideas were changed. Much of the practice was not that different apart from magnetic passes of the hands. The use of language, the use of the reactions.
So I understand from what you have just told that this transforming quit approach is draws from resources that are usually not covered in what has become classic hypnosis now, and it draws from resources that go back to the earlier times, all for one thing, and for the other thing is that again, your vast experience in different fields that you all combine together with the transforming therapy approach. You combine it to a method to stop smoking that is probably in that way not found anywhere, not in the non-hypnotic world and not even in the hypnosis world. So even if you don't want to stop smoking with that, you may learn a great deal from your approach, how you handle smoking cessation. And well, I'm already hoping that people want to take this course because I want to take it. Thank you, John. It was a great pleasure to talk to you, learn more in depth about the courses that we are planning, and I'm looking forward to doing with you the next interviews, the next talks, and prepare the workshops next year. So to all of our listeners, have a safe day, good time, and see you soon again.
Thank you very much. Goodbye for now.
Goodbye for now.